We're going to begin by cooling the tattoo. Begin cooling the skin for 3 to 5 minutes using Zimmer or ice globes. Now let's assess the tattoo. Review how many treatments the client has received. Look over the color seen on the tattoo and ask the client the following questions to determine which settings to use on the laser. First, ask them how long ago did they get their tattoo. This determines how many treatments they are going to need. Ask them if they've received their tattoo at a shop. This will determine the quality of the ink. For the color settings, black is going to use the Zoom 1064, purple and blue will use the Zoom 532, and pastel greens and blues will use the 730 handpiece. The first treatment will always use the Zoom 1064. Use the Zoom 1064 until all of the black is out of the tattoo. Assess the colors left over and decide which handpiece will better assist in removing the leftover color. On thinner skin, this spot size is going to be more superficial because the tattoo isn't too deep. Feel around the tattoo for any scarring underneath the ink, because if there is scarring, you'll need to inform the client that they will see the scar when the ink is gone. Now let's set the laser. Now you'll want to attach the correct handpiece to the device. Set the laser according to the parameters on the laminated protocol sheet attached to the PicoWay laser. The settings will depend on what the ink looks like the day of the treatment and not based on what settings were used on the last treatment. Choose the wavelength based on what colors are visible the day of treatment. If it's the first treatment and there is no black visible, then test spot at 1064 as there may be black mixed in. If there is no reaction, you will need to switch your wavelength according to the colors you are treating. On our model here, I'm going to treat her at a 5mm because her tattoo is more superficial. The recommended start point for a 5 on a 4 skin type is 1.5. I'm going to leave the hertz at a 2 because it's a smaller tattoo. Now we're going to cleanse. Remove any product that might be on the skin using alcohol. Now it's time to perform laser tattoo removal. Get both the client and yourself a pair of protective goggles to wear during the treatment. Once the skin is cold to touch from the Zimmer or ice globes, perform a test spot on an outer corner of the tattoo to see what kind of reaction you get. If you see blanching of the tattoo resulting in an off-white color, the settings chosen are correct, and you may proceed. The ink will come back, so you don't want the client to assume this is the end result. If blanching occurs and the spot is starch white, the settings are too high and need to be adjusted. If no reaction occurs, then the settings are too low. Without double stacking, treat the entire tattoo. Stop to cool the skin as much as necessary for client comfort and depending on the size of the tattoo. When you have treated the entire tattoo, cover the tattoo using gauze and medical tape. Last, you want to give the client their proper aftercare instructions.